Hello and welcome back to my channel. If this is your first time here, I'm Nurse Alyssa, and today we're going to talk about why diabetics have a hard time healing their wounds, or they can heal very slowly. But first, if you could hit that subscribe button, it would be greatly appreciated, as it truly does help my channel reach more people. So let's get started, guys. So there are a number of factors that can affect diabetic healing, and the first one that we're going to talk about is a high blood sugar. So blood sugar level is the main factor in how quickly your wounds will heal. When your blood sugar levels is higher than normal, it prevents nutrients and oxygen from re-energizing cells, prevents your immune system from functioning effectively, increases inflammation in your body's cells, and these effects slow down the healing process. Next, we have neuropathy. So this can be a result of having a prolonged high blood sugar level. Over time, there's damage that occurs to the nerves and vessels, causing loss of sensation normally within the feet and hands. When they have diabetes, they can't feel that there is something either in their shoe or their shoe kind of rubbing in an inappropriate way. They can't feel this, so then the blisters are forming. If you have normal sensation, we're going to be like, okay, ow, that hurts. I'm going to switch out my shoes, take off my shoes, kind of stop doing what you're doing because it hurts. When you have neuropathy, you just keep going because there's no pain, because the loss of sensation. Next, we have poor circulation. So people with diabetes are 2 times as likely to develop peripheral vascular disease than those that do not have diabetes. Peripheral vascular disease causes blood vessels to narrow, which reduces the blood flow to the limbs. These conditions also affect your red blood cells' ability to pass through the vessels easily. A higher than normal blood glucose levels increases the thickness of blood, affecting the blood's ability to pass through even more. Next, we'll look at immune system deficiency. So many people with diabetes have a problem with their immune system activation. The number of immune fighter cells sent to the healing wound and their ability to take action is often reduced. And if your immune system can't function properly, wound healing is then slow. Then that brings us to infection. So if your immune system isn't functioning properly and it's not activating to defend off bacteria, that means you're at an increased risk of infection. Higher than normal blood sugar levels also increase the possibility of infection because bacteria thrive on the extra sugar in the bloodstream. High blood sugar levels can also prevent immune system cells from being able to fight off invading bacteria. And if an infection is left to just kind of spread, it can cause gangrene and even sepsis. So with diabetic wounds, they really need to be monitored and caught quickly, okay? Complications can happen rather quickly, and they are a real cause for concern with people who have diabetes because they can progress rapidly, causing amputation and even death. So how are we going to help the healing process? So really, first off, we want to prevent. So prevention is key. That's really my number one. If we can prevent something from happening, especially in wound care, that's what we want to do, because once we have a wound, we have to go back to preventative measures anyways to actually heal the wound. So we're going to do this by doing regular self-checks, morning and night, checking your feet. Look for any abnormalities, color changes, anything out of the ordinary. Report it to your general practitioner right away. Check the inside of your shoes and your socks. So you want to make sure that there's no tacks stuck inside, there's no pebbles, stones, anything out of the ordinary in the shoe, or any seams in your sock that could be rubbing that you're not feeling, okay? So we want to minimize any kind of friction on the feet. If you do have a dressing, you want to make sure that that dressing is kept fresh. I suggest wearing white socks during this time because you will see if any drainage is leaking or if there's any blood. If you do have a pressure injury, we want to keep pressure off the area. So wearing offloading shoes. The gold standard of ulcers on the feet is total contact casting. But if that's not something that's available to you, offloading shoes are an amazing next step to that, okay? And then you just want to work with your doctor and wound care specialist for proper care and treatment of the wound, okay? Be part of the team. Make sure that it's a plan of care that you're able to follow, and then do follow through with the dressing changes. If you do need to do the dressing changes at home, do so. And then don't miss any of your appointments with your doctor or wound care specialist. Now, there are a few things that you can do to promote long-term health and healing. So eating a healthy diet, staying active, and if you do smoke, to quit smoking. Smoking is a really big factor when we're trying to heal wounds because it does constrict blood vessels. So those who do have diabetes, and we already have increased risk of peripheral vascular disease, narrowing of those vessels. When we smoke, it narrows them even more. So I know a lot of people do have a problem, and when I say like, oh, like you should stop smoking, they kind of just shut off. So I always suggest, if you can just cut back 1 cigarette a day, just focus on that 1 cigarette a day until you're cut down to those 2 to 3 smokes per day. We're getting more healing than we would have. Okay, so that's what I suggest. I mean, if you can cut right back down to nothing, obviously that's what we want, but if you can cut down as much as possible, just cut out 1 smoke a day. Just start by cutting out 1 smoke a day, and then the next day, just let that kind of snowball effect go. So I hope you did find this video helpful. These are all the reasons why we do have slow healing with diabetic ulcers. I hope you did find it helpful, and I hope to catch you in my next video. Bye for now.